Well, hello everyone, and welcome to this edition of IPC's Vendor Advantage Network, our preferred vendor spotlight. My name is Shannon Battle. I'm the Pharmacy Services Manager here at Independent Pharmacy Cooperative, IPC. I do manage the Vendor Advantage Network, and I work with vendors like Quidel Ortho to find and bring you all the best clinical, retail programs, really any vendors that your pharmacies are looking into and need to help move that pharmacy forward. So following along with our current focus, we're working on point of care testing and point of care solutions with this quarter. Today, I do have the pleasure of sitting down with Allison from Quidel Ortho. They're one of our preferred vendors, and they have some great options for some of our stores looking to both expand their point of care testing and the education that they're providing to their patients. So, Allison, welcome.
Thank you so much. I'm happy to be here.
Awesome. Well, I do thank you for providing the slides today. There's a lot of great information ahead, so let's go ahead and jump right in.
Awesome. All right. So my name is Allison Leone, and I am a medical technologist. I do have my degree in medical technology I was at Illinois State University. I grew up in Illinois. My career pretty much at the beginning focused on laboratory medicine, clinical hands-on, and then I moved over into the manufacturing side where I did a lot of different things, technical installation, sales, marketing, etc. So I've had a bit of experience over here. I've been with Quidel Ortho for 9 years, 5 years now, 4 years prior, and then I left and came back. I really like working here. So that's a little bit about me.
Awesome. Well, let's move right into what you guys have to offer then.
Awesome. Okay. Well, when we think about testing, we definitely have the right solutions for for the consumer healthcare areas. We do have a lot of products in retail clinics and pharmacy. And what we have is I like to look at it from 3 pillars. We have an at-home solution for COVID testing, and then we have 2 solutions for professional or RX testing, as I like to call it. We have QuickView, which is a visually read solution, and then we have Sophia 2, which is a instrumented solution. So you have one that's more objective and one solution that's subjective. So you have to look at both solutions and decide which one will fit your organization and facility best. We do have broad test menus. We really focus on infectious disease, specifically respiratory, and we do extend out to a Lyme disease solution as well.
Awesome. So really important to, if you're not already doing point of care testing, to get into it with, cold and flu season and everything else coming up. You want to be that hub for your patients.
Correct. All right.
So QuickView.
Let's have a quick talk about QuickView. So QuickView has been tried and true. It's been in the market since I want to say early 80s, where we did have an over-the-counter solution at that time. And then we moved into the professional markets solely until about 2020, 2021, when we came out with an OTC during the pandemic. So QuickView, actually probably more than 30 years now. It would be like 35 years. But they haven't updated this, so I'll just go with 30. And so what it does is with the point of care testing, it just helps you get that result a lot faster so that you can treat the patient quickly. QuickView, as you can see to the right, that's what the strips look like. The little arrows help you know to put the strips into the sample with the arrows down. And it has internal procedural controls so that you know that the test was processed appropriately. The kits, with the exception of the SARS, have 24-month shelf life. SARS is 12 because this one is still EUA. We're working on completing that process, converting to the 510K. What's great about our kits is they come with everything in the kit. You don't have to worry about sourcing swabs or anything like that, or getting controls. Controls come in the kit. And what it really allows you to do is customize your test to treat program if visually read testing is what you decide you'd like to move forward with. So moving into Sophia, Do you have any questions, Shannon, before I bounce into
No,
the?
no, I
Okay.
think they're both gonna be good for all of our pharmacies. So we'll go over this one next, and then we'll talk more on that.
Okay, great. And then what we have is we have Sophia too. Um, we have over 70,000 of these units placed. I do have large pharmacy systems that do utilize Sophia. I also have pharmacy systems that utilize QuickView. The one thing about Sophia is while it's an instrumented solution, it's a very small solution. So the footprint is very compact, which is really great. It's also a high volume solution. So if we ever find ourselves in a pandemic again, which I hope that never happens, but if we do, marketing says you can get 50 tests through an hour. I say 30 because I'm realistic. There are, and we'll get into it in a minute, but there are two different modes, and I'll talk to you a little bit about how that works. It is an objective result because you're not having to look at it and make a decision. If you think you see a faint pink line, it just kind of takes that out of it, where you're not quite sure if you want to call it positive or negative. It's also very cost effective. I will go into contracts and pricing, but I actually did get major discounts on the tests per test basis. And so that's a really great situation. And then we can also integrate into your systems, or you can access data on the system. So with a visually read, once the timer goes off, if you don't read it within 5 minutes, you have to start over. With Sophia, it holds that result for you.
That's nice. That's good, especially within the busier pharmacies where they can't necessarily get right back to it or stand there and wait the whole time either.
Exactly.
All right.
All right. So what's nice about Sophia is there are really no trade-offs. What you have is you have a system that's quick, that gives you the right result at the right time for a reasonable price, where you can, if you're a cash payer, if you can request reimbursement, medical billing, however you're doing it in your pharmacy, it is affordable, and you will, while the most important thing is taking care of the patient, it also helps your bottom line and allows you to make a little revenue off the test as well.
Absolutely.
So what's really cool about the Sophia is flu, RSV, and RSV have what's called ART technology. And what that means is flu and RSV are 15-minute tests. But what happens is when you put the cassette in the Sophia, if you're using the walkaway mode, it'll look at the result or look at the cassette every 3 minutes. If it comes up positive within 6 minutes, 9 minutes, it'll give you that result. So you're not having to wait that whole 15 minutes, and you're able to go ahead and move the patient through the system.
That's amazing.
So here I mentioned walkaway mode and read, and so what walkaway mode is when you put the sample on, you process the sample, you put the sample on the system, you close the drawer, and it times it for you. For strep, it's 5 minutes. For flu AB, it's 15. For SARS Plus, it's actually 10, and it's 510(k) approved. So it's a 24-month shelf life. And so all you do, put it on, walk away, it beeps, it tells you it's done, you go, you pull the result, and you go from there. But there's the read now mode, and this is where that high volume is loaded. So like when you had people coming in for COVID testing during COVID, you might have had a family of 5. What you can do with the read now mode is you go ahead and you process all 5 people. You put the first one on in the walkaway mode, and then you switch to read now. And it says 1 minute, but it's actually 11 seconds. Every 11 seconds, you can get another result, another result, another result. So instead of having to wait 10, 15 minutes per sample, you wait for the initial incubation of, say, 15 minutes, and then within a minute, you can have the other 4 samples and you can treat and get them out.
That's an amazing feature. That really gives our pharmacies, the ability. They're always looking for a way to, to host a clinic or something like that, and to be able to be a point for all of your patients and community to come in at certain times of day, and then you can handle those large crowds, coming in. That's going to be amazing for pharmacies to have that opportunity.
Yeah, and the other thing to the point of a clinic is the system does have a battery and you can run for 4 hours on battery. So if you did have to take the system away from the pharmacy area, you could do that successfully.
Right. Amazing.
Yeah. And so I talked a little bit about how it has data on the system. So it does hold 1,000 samples. I call it FIFO, first in, first out. Um, Additionally, you can add a USB to the back of the unit, and however big that is, it'll save the results there. I like that for if you are going to get audited, right? Then you can pull the USB out once a month, save the files to your hard drive and to wherever you back them up. And then when the auditing body comes in, you can say, here's my QC, here's my patient results. And then the other thing is, it doesn't happen, at least I haven't had it happen since I've been here. If there is a recall, you can go in and you can sort by the what do you call it? The lot
A
number. And
lot.
then yeah, and so then you can quickly grab that information and recognize if there was any issue, right? That doesn't,
Right.
I haven't ever had that. I haven't seen a recall. Gosh, I don't even remember the 4 years I was here before where I saw a recall. Um,
Just having that capability, that record
yeah,
keeping capability versus, our old school pharmacies, we're writing down lot numbers everywhere and having to flip through
right.
papers. So this is great.
Yeah. And then there's a barcode scanner. So if you wanted to use a barcode, it's not separate, it's all in there. And then we also have this nice little barcode to, if you, because you might not want to let everyone go into the unit where you have to barcode into the unit so that it's locked and if you don't if you're not trained appropriately.
Right.
We do have printer capabilities. That would be something you would purchase. I always send people to Amazon. You can buy it from us, but it's much cheaper going through Amazon.
The clear
So,
weight.
so here's our menu. We have the Flu AB, so 2 targets in that one. We have SARS Plus. And what's great about this is we actually received the 510K de novo. And what that means is we were the first to market with a 510K approved solution. And with that, every other vendor who comes out with an antigen test, we're the comparator. So everyone has to compare to us, which is kind of a big deal.
Yeah.
Yeah, and then we have flu plus SARS. Again, that one's still EUA. We're working on that. I believe we're expecting to submit, I want to say in March. Last year was a low season for flu. And so the clinical trials are bleeding into this year.
Right.
We also have RSV, we have the strep A, and we have Lyme disease.
Right. And then as far as the clear waiver, I know a lot of our stores have reached out, asked about how to getting set up with that. And our pharmacy services team, excuse me, we normally, we have links on our website to help them go through that process, show them how to do that. Do you guys provide any support there or have any suggestions or anything like that that they can talk to you about as well?
Absolutely. So I can help you with that. Just let me know and I'll go through. We can get on a call and we can fill out the form. I think it's Form 116, CMS Form 116. I'll confirm that. And then I can help you put it together, put the information in there. You do have to put things in like your hours of operation, when you think you'll be, so there are things that you'll know that I won't know, but I can help you get started.
All right. So contracts and pricing. Let's talk a little bit
Yeah,
about that.
sounds good. Okay, so we have 2 options for contracting. We have a capital purchase option, and that's where you would purchase the analyzer at $750. It's normally $1,200. I was able to get the discount on that, so that was fun. And then what happens is the price per test there, the CPT, farthest column to the right, is what you would pay per test. And then we do have a placement. And what that means is you would get the unit at no charge, but you would commit to 50 tests annually and you would still pay the cost per test price there. Just to note, the standard is 300 tests a year, but I was able to get it decreased because pharmacy is a new market, and we want to make sure we can support the pharmacy and the pharmacy can support the program and then grow the program. So that's where it is there. So if you were to, and then also when I commit you for the lower cost, just the flu. And then if you run flu plus SARS, that covers the flu, which is a little more expensive. So anyway, I just want to make sure it's most beneficial to the pharmacy. So essentially, if you ran one flu kit and one strep kit, they each have 25 tests, and it would be a startup cost with the placement of $381.25.
That's an amazing deal, especially for any store that, is trying to figure out how to get their, feet in the water, we'll say, or, want to do, like we said, a clinic or something. That would be an easy way to get in and really utilize those tests and not have to worry about it.
Absolutely.
Awesome.
As far as pricing, you can see $11 for SARS. We have 14 for the combo is what I call it. I call it ABC, flu A, flu B, COVID. And then we have just flu AB, and then strep. We have Lyme disease, and then we have RSV.
All right, perfect. Well, Allison, I appreciate you spending the time with us. This has been great information. I think there's a lot of points here, for stores that are still kind of on the edge, not ready to jump, but are interested. I think this will help a lot. And of course, if you're watching, feel free to reach out to either Allison or myself. We both can get, the information that you need. We can help get you signed up. And you do see the QR code there. It'll take you right to the IPC vendor page. All you have to do is fill out the short contact form. And that's not to get signed up or not to get any information to you, but even merely to just ask a question. So we'll reach out and see if you're ready to go, if you have more questions. So if anyone has any questions, again, you can feel free to reach out to either of us. I do thank you all for being here, and Allison and everyone else, I hope you all have a great afternoon.
You too. Thank you.
Thank you.